On behalf of the research team at the Perinatology Research Branch, Eunice Kennedy Shriver National Institute of Child Health and Human Development, National Institutes of Health, and the Department of Obstetrics and Gynecology at Wayne State University School of Medicine, it is a pleasure to present our study. Fetal growth restriction is characterized by changes in a biomarker of glycocalyx integrity. The diagnosis, surveillance, and time of delivery of fetuses with suspected fetal growth restriction are major issues in obstetrics. There is a growing interest in finding additional imaging modalities or placental biomarkers able to reflect the presence of placental insufficiency and underperfusion and to improve the detection rate of growth-restricted fetuses. A subset of small for gestational age infants are growth-restricted, and this condition is often attributed to placental insufficiency. Syndecan-1, a product of the degradation of the endothelial glycocalyx, has been proposed as a biomarker of endothelial damage in different pathologies. During pregnancy, a specialized form of the glycocalyx, the syncytiotrophoblast glycocalyx, covers the placental villi. The purpose of this study was to determine whether the concentration of maternal plasma syndecan-1 can be proposed as a biomarker for fetal growth restriction. Study design. A cross-sectional study was designed to include women with normal pregnancy, N equals 130, and pregnant women who delivered an SGA neonate, N equals 50. Doppler velocimetry of the uterine and umbilical arteries was performed in women with an SGA fetus at the time of diagnosis. Venipuncture was performed within 48 hours of Doppler velocimetry, and plasma concentrations of syndecan-1 were determined by a specific and sensitive immunoassay. The principal findings of this study are: 1. Plasma syndecan-1 concentration followed a nonlinear increase with gestational age in uncomplicated pregnancies. 2 South African Rand equals 0.27, p less than 0.001. 2. Women with a pregnancy complicated with an SGA fetus had a significantly lower mean plasma concentration of syndecan-1 than those with an appropriate for gestational age fetus, p equals 0.0001. 3. This difference can be attributed to fetal growth restriction, as the mean plasma syndecan-1 concentration was significantly lower only in the group of women with an SGA fetus who had abnormal umbilical and uterine artery Doppler velocimetry compared to controls, p equals 0.00071, adjusted p equals 0.0028. A trend toward lower syndecan-1 concentrations was also noted for SGA with abnormal uterine but normal umbilical artery Doppler velocimetry, p equals 0.0505, adjusted p equals 0.067. 4. Among women with an SGA fetus, those with abnormal umbilical and uterine artery Doppler findings had a lower mean plasma syndecan-1 concentration than women with normal Doppler velocimetry, p equals 0.02, adjusted p equals 0.04. 5. An inverse relationship was found between the maternal plasma syndecan-1 concentration and the umbilical artery pulsatility index, R equals -0.5, p equals 0.003, and 6. A plasma syndecan-1 concentration less than or equal to 850 nanograms per milliliter had a positive likelihood ratio of 4.4 and a negative likelihood ratio of 0.24 for the identification of a mother with an SGA fetus who had abnormal umbilical artery Doppler velocimetry, area under the ROC curve 0.83, p less than 0.001. Discussion. This is the first study in which maternal plasma-soluble syndecan-1 concentrations have been correlated with umbilical and uterine artery Doppler velocimetry findings in pregnancies complicated with an SGA fetus. Taken together, these results suggest that syndecan-1 may reflect placental disease, thus giving value to its possible role as a biomarker for FGR. In our study, a plasma syndecan-1 concentration less than or equal to 850 nanograms per milliliter enabled the identification of mothers with an SGA fetus who had abnormal umbilical artery Doppler velocimetry among the study population, AUC 0.83, p less than 0.001. The accuracy, however, was low and unlikely to justify the implementation of syndecan-1 as a sole biomarker for this condition. The diagnosis, surveillance, and time of delivery of fetuses with suspected FGR are major issues in obstetrics. There is a growing interest in finding additional imaging modalities or placental biomarkers able to reflect the presence of placental insufficiency and underperfusion and to improve the detection rate of growth-restricted fetuses. Proposed candidates are proteins highly expressed in the placenta relative to other tissues such as serine peptidase inhibitor Kunitz type 1, SPINT1, and growth differentiation factor 15, both previously investigated in the prediction of FGR. The results of this study provide further evidence for a possible role of plasma syndecan 1 in the early identification of fetuses with restricted growth during pregnancy. Conclusion: low maternal plasma syndecan 1 may reflect placental diseases, and this protein could be a biomarker for fetal growth restriction. However, as a sole biomarker for this condition, its accuracy is low.